Hello, thank you so much for taking the time to join me on this virtual client evening. We've really missed hosting the client evenings at Bellevue Clinic, so I thought I would try this out instead. And I'm going to talk a little bit about my recent experience working as an equine vet in Australia. So just to introduce myself, most of you have known me for a very long time, probably most of my life. But some of you might not have met me. So this is a picture of me, age 2, helping my dad stock his vet car. I grew up around here. I was a member of the Wiley Valley Pony Club and then the South and West Wilts Pony Club. And then I went and studied veterinary medicine at the University of Liverpool. And following graduation, I went to New Zealand, where I worked at a referral hospital for 2 years. It was a predominantly thoroughbred caseload, and lots of racing and stud medicine there. And then I came back to England and worked at Bellevue Veterinary Clinic, where we have a hugely diverse caseload. We have eventers, dressage horses, show jumpers, Shetland ponies, donkeys, draft horses, and everything in between. And then in 2020, I decided that I would really like to work on my equine stud medicine skills, and I took a stud locum position at Newmarket Equine Hospital. And then I took a seasonal position in the Southern Hemisphere at Tamworth Equine Veterinary Clinic in Australia. And now I'm delighted to be back at Bellevue Veterinary Clinic. So previously on my client evening talks, I did a talk about my time in New Zealand, and everyone that came did a shoebox for Operation Christmas Child. It was at Christmas, and it was a really good evening, and that was a good thing that we all did. So I was wondering today, if you enjoyed this talk, perhaps it'd be amazing if you could give a donation to the Riding for the Disabled, which is another charity I'd like to support. So, starting at the beginning, my journey to Australia during a pandemic. I started with a 7-hour flight to Doha, and then a 15-hour flight to Sydney wearing my mask and visor. Then on arrival at Sydney, we were escorted by the military from the airport to our hotel quarantine rooms, where we stayed for 14 days. You weren't allowed to go into the corridor or open a window. You were in that room. And we were all tested on day 2 and day 10 for COVID. And I passed the time with yoga, and I also did 60 hours of online vet lectures. So I was really raring to go when they finally let me out. And my final destination was Tamworth, which is in New South Wales, and it's known as the country music capital of Australia. That's a picture of me and a friend in front of the Golden Guitar, which is a highly coveted award at the annual country music festival that is usually held in Tamworth. And to sum Tamworth up in a few words, it's very hot. There's lots of flies, there's bats, snakes and spiders, and I did actually enjoy my time there, even though it sounds a little scary. These are a few of the amazing creatures I just saw out and about between my calls. So starting on the left, we've got a frilled neck lizard, a green tree frog, a huntsman spider, which did take me by surprise as I was just checking an inpatient at night, some white cockatiel and parrots. I'm sorry I'm not more specific on what type of parrot, but there was just amazing colourful birds in all the trees, which was wonderful. So the caseload in Tamworth was very different to what I'm used to in Somerset. The horses, quite a few of them were stock horses that were used for farm work, checking cattle over huge distances in very high temperatures, and quarter horses used for camp drafting, cutting, which is when they've got a pen full of cows and they choose the one that they want and they try and get it away from the rest of the cows. They cut it, that's the expression, and then they show they have control over it by taking it in a route around barrels and barrel racing. And as you can see from these pictures, it's extremely hard on the horses' hocks and stifles, so really sinking down low. So I saw a lot of hock injuries and stifle injuries during my time there. Another thing that I don't have to think about in Somerset, which I did have to think about out there, is Hendra virus, which is extremely serious, and it's a virus that lives within fruit bats, which are known as flying foxes. These flying foxes live in the trees, and their droppings can sometimes land in the horses' water troughs, which is how the horses tend to get infected, and then the horses potentially can pass it on to humans. So what makes it quite a challenge to deal with is that horses infected with Hendra virus show such a wide range of clinical signs. They can be anything from a classic colic to just high temperature, dull, off their feed, neurological signs. So you really have to have it at the back of your head whenever you're going to see a case that's slightly unusual and the horse is not vaccinated. It's very serious because approximately 80% of horses and 70% of people infected with Hendra virus die. So I was very fortunate that I didn't actually come across the virus, but I always was wearing my protective equipment when I was going to see a horse with a bit of a suspicious history, and I didn't know its Hendra status. Okay, so the main reason for going to Australia was to further my equine stud medicine skills, primarily artificial insemination and embryo transfer. So I thought what I'd do is just give a little bit of an overview of that, a very basic overview, but if you would like to breed from your mare and you want any more questions, you can always give me a call. So starting at the beginning, the gestation period for horses is approximately 11 months. In the Northern Hemisphere, mares cycle between February and October, although the cycles at the very beginning and end of this period are quite irregular, and it's known as the transition phase, so the optimal fertility is more in the middle of that time period. If you are thinking of breeding from your mare, whether that's natural cover or artificial insemination, it's a really good idea to get a pre-breeding examination done. During this examination, we will evaluate the vulval conformation, perform a rectal examination and an ultrasound scan to look for uterine cysts, and also see what stage of the cycle your mare is at. And we'll also take some swabs and blood samples to check for any diseases. The main ones, the clitoral swab checks for contagious equine metritis, and the blood test check for equine viral arthritis and equine infectious anemia. So, artificial insemination, the basics. So you can be using fresh, chilled or frozen semen. So you find out, what's available from the stallion that you like. Then the mare will have to be scanned, probably multiple times, to find, to know exactly where she is in her 21-day cycle. And then broadly speaking, you are trying to inseminate as close to ovulation as possible, although the timing does vary depending on which type of semen you're using. And then post-insemination, there'll often be some uterine treatments used to increase the chances of a successful pregnancy. And then the first pregnancy scan will be between day 14 and day 16. These are just a few pictures I took of my ultrasound scanner, so apologies, see they're a bit dusty. So starting on the left, we've got pregnancy at day 15, day 42 in the middle, and if that was a video, you'd be looking at a heartbeat as well. And then on the end, day 60, where you can see that it's really starting to resemble a foal. If unfortunately you've got your mare doesn't go in foal, then there's quite a lot of things we can do to investigate the causes of potential infertility. So quite often we start with doing a uterine swab or lavage and culturing that to see if there's a particular type of bacteria growing and that might be causing a problem. We can look at the semen under a microscope and assess the numbers of semen, their morphology, what they look like. We can also use advanced programs to check their progressive motility. So look at, are they going in the right direction or are they just swimming around in circles? Lots of things. These are just, some very basic ideas, but there's lots available. And one thing that I really, benefited from it in my time out there was gaining some exposure to embryo transfer. And that's a picture of myself and a colleague in the corner performing an embryo flush on day 8 of pregnancy. You need to have a recipient mare at a similar stage in her estrous cycle to the donor mare, so they're synchronized. And we're lavaging the donor mare's uterus, flushing out the embryo, and I'm holding a little cup with a filter in there to catch it. Of course, you usually can't see that with your eyes, then we'll put that through, assess that under a microscope and find the embryo. So the main advantages of embryo transfer is that you can get multiple pregnancies from one mare in a year, and that your donor mare can continue competing. So on the left there, that's what a day 8 embryo looks like. That's just a close-up of me holding that filter. So I thought I would do a little bit of a talk about some of the memorable cases from Australia, and it's been quite hard to whittle it down to 3, so I've just shoved a few more pictures on that slide because I couldn't pick. But I'm going to start off with one very sweet case. So this isn't gory, this one. This is Marnie, and Marnie was a dummy foal, or more correctly termed, she had neonatal maladjustment syndrome. And she had that because she had a very difficult foaling and she was deprived of oxygen during delivery. And now I'm just going to talk a little bit more about what neonatal maladjustment syndrome is. It's got quite a few fancy names, but you're probably most familiar with it being called a Barker or a dummy foal. And the potential causes are quite varied. Often seen after a red bag delivery, which is when the placenta separates very early from the mare, so the foal is not getting the oxygen via the placenta, or if there's dysfunction of the placenta, so placentitis. If there's a difficult or prolonged delivery or emergency C-section, so a dystocia where perhaps the foal is not presented correctly, the limbs are facing in different directions, or the foal might be in breech. Or interestingly, it can occur after a very rapid foaling, and that's basically because during pregnancy, progesterones present in the foal's blood have a mild sedative effect, and in normal foals, blood progestogens drop rapidly at birth, and that's thought to be because of the squeezing effect of the foal's rib cage during delivery, as going through the pelvic canal. But foals born very rapidly that then show neurological signs often have abnormally high progesterone concentrations. So what we can do is the Madigan foal squeeze, which is where you place some soft ropes around the foal's ribs and squeeze for 20 minutes. And that's thought to mimic the birth process of foaling, and it has been shown to show an improvement in the behavioural signs of some foals with neonatal maladjustment syndrome. Obviously very important to check that there's no broken ribs before you apply the ropes. So clinical signs of dummy foals: they're often unable to stand, they have a very poor suck reflex, and they can't find the udder and nurse, which is usually instinctive for healthy foals. They often have a head tilt and walk around in circles, and some of them can be seizuring. Now, often these signs are apparent right from the off, but sometimes they don't become obvious until they're 24 to 36 hours old. So we were lucky that Marnie was able to stand up and walk around by herself, but she had no clue about how to find the udder and had no suck reflex, so she required some intensive supportive care. So she was fed through an indwelling nasogastric tube, and because she's a neonate, she needs to be fed very frequently, so every 1 to 2 hours. Once she developed a suck reflex, she was able to be fed through a bottle, which was a bit easier. And that's a picture of me milking her mum. She's a very, very good mum, so that she could have her mum's milk, which is nice. And then on day 8 of life, she actually had improved and she was able to drink from mum and she could go home, which was really rewarding because of quite a few sleepless nights of feeding her every 1 to 2 hours. Some of the dummy foals require a lot more intensive management. So if they can't stand up, then you have to keep turning them from different lateral recumbencies. Some of them require nasal oxygen, intravenous fluids, intravenous nutrition and plasma transfusions. But if you have a full-term normal birth weight foal and it doesn't develop complications, they can have a good prognosis and about an 80% survival rate. So it was a real success, and this is Marnie nursing from her mum and at home galloping around, so that was lovely. Okay, my next case I'd like to talk about was a foot penetration which resulted in a septic navicular bursa. So this was a stock horse that that stood on a nail, which damaged many of the structures inside his hoof. And he was seen by another vet and then sent into Tamworth Equine Clinic. when he got there, the sole was thoroughly cleaned and a sterile metal probe was inserted into the tract, which reached the navicular bursa. So we took an x-ray of when we had the sterile probe in to see how far the tract went, and then we were very concerned because we could see, it's basically touching the navicular bone. So we placed a spinal needle between the heel bulbs, and that's the approach to get into the navicular bursa. And then we took an x-ray of that to check we were in the correct location, that's on the right, and we filled up the bursa with saline, sterile saline, and if the bursa is intact and not damaged, then that saline would just stay there and it would be under a lot of pressure, but it wouldn't, come out of the sole. But because in this horse's case the navicular bursa had been breached, as we were putting the fluid in between the heel bulbs, it was dripping out of the sole, which confirmed to us that the bursa would then therefore be compromised. So this was a very serious injury, and the horse was very, very lame. He had to have a general anaesthetic and lots of fluid flushed through that and antibiotics placed in the bursa. It was only about a 50% survival because it's so serious, but fortunately he held his own, and following surgery he has a long road ahead, but he is doing really well, and he was kept in wedged shoes to take the strain off the deep digital flexor tendon, but he's weight bearing evenly on both forelimbs and happily back home, which was lovely. So my third case, many of you know that I really love ophthalmology, and I was lucky to be involved with management of several corneal ulceration cases while I was in Australia. These in particular were racehorses that were galloping, and big clods of mud coming and whacking them in the eye. So I'm just going to give you a little bit of background about the structure of the cornea and why ulceration is so serious. So the equine cornea is actually only 0.7 to 1.5 millimeters thick, and it is extremely sensitive structure, so damage to it is very painful, and it requires intensive management, because if that ulceration is to become full thickness, then the eye will perforate, and healing can be very slow because the cells only migrate at 0.6 millimeters a day. So if you have a large ulcer, then it's going to take a very long time to heal, and that's provided that you keep the eye sterile and there's not bacteria in there, which is working against your epithelial cells healing. So the diagram just shows you the different layers of the cornea: the superficial ulcer, the deeper ulcer, and then the desmetacele, which is when you're just at the final thin membrane before the eye perforates, and then the iris prolapse. So how I like to manage these is with a subpalpebral lavage kit, which is a very soft plastic tube which you insert through either the lower eyelid or the upper eyelid and thread through the mane, and then this allows you to stand at the horse's shoulder and administer the medication, which is often very intensive, every 1 to 2 hours, and it prevents the horse becoming head shy, because if you're doing that every 1 to 2 hours in a very painful eye, really fighting to pull the eyelids open, then you're just going to make the horse head shy. So the subpalpebral lavage kit is very beneficial. So in these cases, they were extremely large ulcers, so I've applied a stain called fluorescein, which sticks to the second layer in the cornea. So when you've just got a superficial ulcer, the area that's ulcerated will stay in bright green. When you've got a more serious ulcer that is even more deep, it doesn't take up the stain, so that's very worrying, because on the picture on the right there's obviously an extremely large superficial ulcer, but then just to the inside there's a crater which is not taking up the stain, and that indicates that that area of cornea is exceptionally thin and could perforate. So this horse was treated every 2 hours with serum and antibiotics, and it was I examined the eye, I sedated him and examined it and applied stain every day so I could monitor the progress, and 3 weeks later it had completely healed and there was no fluorescein uptake, which was fantastic. The way the cornea heals, there will be a bit of a cloudiness, but it's no longer painful and he has his vision, so was a really good response. The rate of healing does depend on a few factors. Older horses will heal more slowly, particularly if they have Cushing's disease and it's not treated, or if there's certain bacteria there, then you're going to be fighting against those, and that's going to slow the rate of healing. And then finally, I just thought I'd squeeze in a few different wounds and hope that they're not too gory. I don't think they are. Along the top row, I've got a horse there that got her cheek caught in the gate catch and really ripped a large chunk of it. There's a big flap. It was crucial that this was repaired properly so that she would have a functional cheek and lips and be able to eat. And so she had a general anaesthetic, and one of the surgeons at Scone Equine Hospital repaired this, and then she came back to Tamworth Equine, where I looked after her with her post-operative care, and fortunately it healed beautifully. Just when it turned the corner, it broke down a little bit, but it healed by second intention, which was wonderful. And then the horse on the bottom was a laceration following getting his leg stuck in a high tension wire fence, and he injured the superficial digital flexor tendon, and actually some of the fibres I'm holding in that glove there, which had to be cut out, and the skin sutured back together. The skin will heal fine, but the tendon is going to be a very long road to recovery, so that was quite an interesting case. Okay, so that was my whistle-stop tour of my Australian experience, and I'm now back at Bellevue, which is fantastic. And I just thought I'd remind you guys that we're available on Tuesdays for our zone days, where we do preventative healthcare, dentistry, vaccinations, passports, microchips, blood samples. And on Thursdays we do the lameness workups and the gastroscopes at the clinic. So thank you so much for listening. I hope it was interesting. If you enjoyed it, please consider donating to Riding for the Disabled. And if you would like more of these stories, then you can follow the Bellevue Equine Clinic Facebook page, or you can follow my personal Instagram page, which is West Country Vet. So thank you so much for listening, and hope to see you soon. Bye.